Hello friends, welcome to my channel Managing Diabetics. Today I'm going to be discussing the issue about your A1C level. So today's topic is understanding your A1C levels in regards to your diabetes treatment. Okay, your A1C text measures your average blood sugar levels over 3 months. This is the one that I've been saying all along, that A1C level, you do your test quarterly. Every 3 months you do your test. So understanding your A1C level in managing your diabetics is very important. So I've started by discussing your best time to check your glucose level. I discussed about that in my earlier video. Now the other video after that was understanding your ideal glucose level. So you see how I'm trying to link them from one another. The best time to check your glucose level is part of managing your diabetics. Then after that, I discussed about understanding the ideal level, your target range for your diabetics. Now the next level is understanding your A1C levels. So I'm trying to link them one after the other on how to manage your diabetics. These are all the measures you're supposed to take in managing your diabetics. They are very, very important. So I'll be discussing understanding your A1C level, or at times it is referred as HB, A1C levels. They all have to do with your hemoglobins. So what is A1C? An A1C text measures a person's average blood sugar levels over 3 months. It can show if glucose management strategies are working over time. I specifically give an example of myself in my previous video, that this was the first plan fashioned out with my family doctor on the way to manage my diabetics. So he started with the A1C level, that he put me on A1C level test for 2 years. That is, every 3 months I have to undergo a blood work to see how I'm managing my diabetics. These are all strategies that doctors use. So an A1C test measures a person's average blood sugar levels over 3 months. It can show if glucose management strategies are working over time. This is one of the best ways to manage your diabetics. Alright, so you have to understand what are the levels. As a diabetic, what are the levels you are expected to make sure that your average blood sugar levels over 3 months remains normal. Okay, so it is very, very important you understand it, and I'm going to give you the levels, the targets of your A1C levels. Alright, so a doctor will need to carry out 2 tests to diagnose diabetes unless the person shows clear signs of the conditions. The first time I started having symptoms of what is wrong with my system was I was having frequent urinations every minute. That was the first symptom that I got, that I reported to myself, to my physician, to carry out a test, a blood work and a urine test that came back that in fact I'm now in diabetics. And my family doctor was so furious. Why did I allow it to go to this extent? So, but that is nature. It has been predestined that I'm going to be diabetic, so I have to accept it and deal with it. So now I'm going to give you guys the range for A1C level. With a person with diabetics, with a person without diabetics, pre-diabetics, all those things, I'm going to give you the levels that you should know. These are all the management strategies in treating your diabetics. As a full disclosure, I've said it several times in all my videos, that I'm only an advocate. As a person living with diabetics for over 10 years, my channel is all about enlightening people in Africa and over the world that there are better ways, or these are the ways to manage your diabetics. there are bases, there are tips, there are certain things you have to understand in order to manage your diabetes effectively. It is not only avoiding adding sugar to your tea that means you are managing your diabetics. There is more to that. And always advise that your physician, your family doctor, is in the best position to map out a plan, a management strategy in dealing with your diabetics. First of all, find out if you are diabetic or pre-diabetic by running some tests. And if you are, then he or she, which is your physician, will now map out a plan, management strategy on how to treat your diabetics and the things you're supposed to know. You have your dietitians. All your dietitians, they are the people in best position to guide you on what to avoid and what to avoid in terms of your consumptions and in moderations of whatever you consume. So I'm always putting out these videos in layman's terms. If you watch all my videos, rarely do I use medical terms in order not to confuse you more. I was several times confused when I go to my family doctor, and when he starts using these medical terms, I get confused. But with over time, he has been with me for over 30 years. So he understands. Anytime I visited him, he doesn't use medical terms. He brings out a skeleton, a full skeleton, and then discuss whatever he wants to discuss with me by pointing me, guiding me through, that I will understand what he's talking about. And that is the way we communicate, and for me to understand what is the issue with my system. So I try as much as I can to avoid medical terms in order not to confuse you guys more. Especially somebody like a mom in the market or a father in his store. If I start using medical terms, he doesn't know. But with the layman terms, I explain it to whoever is listening to or watching my video will be able to understand that there are better ways, there are tips, there are certain things you have to understand in managing your diabetes or living with it. Alright? So that is why on this channel. Now, let's go to the A1C levels. Now, I'm going to give you the 3 levels as a diabetic that you're supposed to know or have it to make sure you keep your A1C level at all times normal. Now, I'm going to give you the first level of A1C, a person without diabetics. That is, if you're not a diabetic at all, your A1C level should be below 5.7%. Please write it down. Your A1C level for a person without diabetes, that means you are not even a diabetic at all. Your A1C level should be below 5.7%. Now, a person with pre-diabetics, this pre-diabetics is on a borderline. You are in between normal and abnormal. So you are in a borderline where the normal stop, where the abnormal start. So you are in between. That is what is referred as pre-diabetics. So once you're in pre-diabetics, you have stand a chance of reversing the trend backwards so that you don't cross that threshold that is going to make you a diabetic. So a person with pre-diabetics, your A1C level is supposed to be between 5.7 and 6.4%. Your A1C level for a person with pre-diabetics is 5.7 to 6.4%. Now, a person with diabetics, your A1C level is supposed to be between 6.5 and over. Okay? So, if you are a diabetic, your A1C level is supposed to be between 6.5% or over. Keep it within that range. Alright? So, it is important you understand your A1C level at all times. It is very, very important. A1C test measures a person's average blood sugar levels over 3 months. It can show if your glucose management strategies are working over time. Okay, so that is why you are being put on this text. So now I'm going to go to chart for children because diabetes also affects adult and children. Alright, now if you have a child that is diabetic, you also have your blood sugar levels. And ideal blood sugar levels varies at different ages of children based on data from the children's hospitals. And the following chart shows the ideal levels of children aged 0 to 10 and over. So if you have a child that is between 0 to 10 and over, your sugar levels differs. It differs with age. Alright, so if you have a child that is 0 to 5 years old, your blood sugar level in milligram is 100 to 180 milligrams. So if your child is from 0 to 5 years old, his or her blood sugar levels should be between 100 to 180 milligrams. Alright? Now, if you have a child that is from between 6 and 9 years old, with 6 and 9 years old, the sugar level is supposed to be between 80 to 140 milligrams. So if you have a child that is 6 to 9 years old, the sugar level is supposed to be between 80 to 140 milligrams. Then if you have a child that is 10 years and over, 10 years and over, the sugar level is supposed to be 70 to 120. Okay? So understanding that children also has diabetics, their blood sugar differs with age. So it is important you know all these numbers. Okay? All these numbers are very, very important. Then there's another type of diabetes, gestational diabetes. I don't know if you heard about it, gestational diabetes. Gestational diabetes occur during pregnancy. These are for people that are pregnant. Often it is temporary condition, but it can lead to pregnancy complications. So if you have gestational diabetes, it occurs during pregnancy. And it is temporary condition, but it can lead to pregnancy complications. Okay? So people with diagnosis of gestational diabetes aim for blood sugar levels similar to those of people with type diabetes, although individual target may vary. So you guys should have this. It is very important that you understand all these guidelines in managing your diabetes. Okay? Follow your doctor's advice. He or she is in best position to map out a strategy in dealing with your A1C. Your doctor will advise the individual on what to do if your blood sugar levels are not within the target range. Your doctor may recommend higher blood sugar target for a person with diabetes than for someone who doesn't have diabetes. Okay? Your target level varies throughout the day. They tend to be lower before eating and after exercise, and higher an hour or so after meal. These are the things that I'm trying to explain in my previous video. Knowing your blood sugar before any exercise and after is very important, because your target level varies throughout the day. They tend to be lower before eating and after exercise, and higher an hour or so after meal. So it is very important you understand the guideline. Okay? When working out a person's glucose target, a doctor will consider individual factors such as age and life expectancy, the presence of other health conditions, particularly cardiovascular diseases, how long a person has diabetics, problem with the smallest arteries in the body, any known damage to the eyes, kidney, blood vessels, brains, or heart, personal habit and lifestyle factors, how aware a person is of low blood sugar levels, stresses. These are the guidelines the doctor, when a doctor wants to type, to map out a strategy, a management strategy to treat your diabetes. The doctor would like to find out these histories from you to know which is the best way to treat it. So understanding your A1C level is very important. With those range, you should be able to manage your diabetics, know the figures, and know your consumptions. You have to know what you are consuming, consume in moderations, every food has sugar in it. So now you're going to be counting your carbs and eating in moderation. It's not eating everything that you see that comes in, it goes into your mouth. So it is very important that you follow these guidelines and see how it works out for you. So my friends, thank you for watching this video today, and please do not forget to subscribe, share, and leave me a comment. If you have any question regarding diabetics or something you don't understand, please send me a question, and then I will respond back with a video to read. And once again, subscribe to my channel and share. See you guys in my next video that I'll be dropping. And my next video after this, I'm going to be dealing with high blood pressures in relation to diabetes. It's very important you understand the complication that comes with diabetes in conjunction with high blood pressures. These are all interwoven. Okay, I want to let you guys, I have to discuss and let you guys know why is it a problem if you're diabetic with a high blood pressure and how to mitigate against it. Because all these are complications you have to tend to avoid. So guys, see you guys in my next video, and I hope this works out for you guys. Thank you guys for watching, and see you guys in my next video. Thank you and goodbye.